Hey guys, I'm Dr. Paul Lynch.
I'm Dr. Tori McJunkin.
And I'm Camilla Binks, I'm a nurse practitioner.
Thanks for joining us for this episode of The Pain Show. Some of you have been following along. We see that we have at least 3 subscribers now.
Mm-hmm.
They're all right here. I subscribe.
So that we're the ones. So if you haven't subscribed yet, take a moment to subscribe below, like our videos, share our videos. We think that this is an opportunity for us to make a difference by educating people about chronic pain.
That's right.
On today's episode, we're going to talk about one of my favorite topics, neuromodulation. And Tori McJunkin is here with me today, as he always is, but my best friend for a long time. And Tori has become one of the world's experts in neuromodulation, so I'm going to defer to you a lot today, ask you questions. Camilla Binks was nice enough to join us.
Thank you.
I'm going to talk a little bit about some of our patients in the clinic and how neuromodulation has changed some of their lives.
Absolutely.
So I hope you guys will enjoy our episode. Tori, why don't we go back? When did we first learn about spinal cord stimulation?
Spinal cord stimulation is a version of neuromodulation.
Yeah.
And we first learned about it way back when we learned about your mother-in-law's pain.
Well, I think that's right. Yeah, I forgot that. So I was going to be a psychiatrist, you were going to be an emergency room doctor. Some people have followed us along and they know that story. That night that I came over to your house and said, this is the career that I want to do for the rest of my life. One of the things I had read about was spinal cord stimulation.
That's right.
And my mother-in-law had severe, terrible pain in her abdomen and her spine. And one of the things I read about that maybe could have helped her was spinal cord stimulation. And so as we were reading about these procedures, this was one that grabbed our attention, right?
Absolutely. Yeah, it was so cutting edge and so, really could treat the underlying source of the pain.
Right.
So it's a device that uses electrical energy and essentially turns off pain signals. And so it can help all sorts of different people. Generally, we say that it helps people more with neuropathic pain, and that's pain that comes from a nerve origin versus like arthritis type of pain.
Right.
Now, I think that's being challenged, and there's some new innovative things, new innovative ways to use it, but that's kind of the building blocks for when this all started.
Cancer pain, neuromodulation can be an option, but it's not the classic treatment that we're doing with cancer pain. But low back pain from a surgery, that might be the #1 diagnosis. Camilla, you were telling us about one of your patients earlier.
Yes.
What have you seen with low back pain, for example?
So I always explain to patients that back surgery isn't always a fix for back pain.
Yep.
Back surgery is usually if there's a spondylolisthesis that you talked about last time.
That's hard to say.
It's very
Can you
hard to say.
Like 5 times in a row.
But oftentimes surgery, they go in and they mechanically fix the issue with the spine, and they may still continue to have neuropathic pain or back pain.
Yep.
So multiple patients of mine and yours come in with continued low back pain after surgery. And so by using the neuromodulation or electricity to stimulate the spine, it helps to quell the pain.
And have you had patients in the clinic that have done really well with this?
Yes,
that
absolutely.
You remember?
And I would also say that oftentimes patients are able to decrease or completely discontinue opioids after stimulation.
That's right.
Dr. McJunkin, would you tell us a little bit about spinal cord stimulation for someone who's had back surgery and still hurts? Does it work?
Well, so, I think that's the thing is somebody gets to the point, oftentimes it's a big process to get to the point where you need back surgery.
Yeah.
And then they're like, finally, I'm just going to have back surgery and I'm just going to fix the problem.
Right.
But unfortunately, like Camilla said, a lot of times, they wake up and then over the next few months, they think they're going to get better and better, but unfortunately their pain gets bad. And there's a condition that's called post-laminectomy syndrome, or some people call it failed back surgery syndrome. But essentially we think that that's a nerve condition, a neuropathic pain condition, where even if you did more back surgery, this person's still going to have chronic pain.
Wow.
So to answer your question, there is a lot of research on spinal cord stimulation. And spinal cord stimulation, is evolving and cutting edge, and there's a lot of new things. But basically, all the new studies say that it has around an 80% chance of helping somebody.
Wow. So a patient who has already gone through everything, has had back surgery, and they still hurt, and they come to you, and you're saying spinal cord stimulation, like 80% of those patients would get better?
So there's 2 steps to it. One is called the trial,
okay.
And it's pretty neat actually.
Do you have like a model where you could show us what a trial looks like?
Yeah, I could show. So I have this model here,
okay.
And so the way that I think of it is kind of like labor epidural. So like a pregnant lady is getting a little catheter to infuse fluid in there when they're giving birth.
Okay.
We do the same thing, although it's not for birth, but we put in these little catheters that are flexible, like little noodles. We slide them up, and then they use electrical energy at the tip. And so at the end of that trial, we take the needles out, we tape this to their back, and then they essentially wear it around for the next week, and they see if it's going to help them.
So this isn't the permanent procedure.
Yeah, exactly. So there's 2 stages. One's the trial.
Okay.
And it's, amazing. It's like one of the few things in medicine where it's like, try it before you buy it. You really get to try it out and see if it's going to help.
Test driving a car.
Yeah, exactly. Yeah. So you can really see, like, is this the right therapy for me? And it's not the right therapy for everyone.
Right.
But when it works, it's amazing.
And you said the number 80%, and I just wanted to hone in on that. When we first started teaching, I mean, we're talking 14 years ago now, we told most of our patients about 50% of patients will do well with this. But the new data from multiple companies is coming out showing that about 80% of their patients get relief from this modality.
That's right. Yeah, we called back in the day, it was called the 50-50 club. And so you had a 50% chance of this therapy helping you long term.
Yeah.
And like you said, like there's been so much innovation in the last, I would say especially the last 10 years. Where all these kind of big companies, technology companies, are coming out with these products that make this massive difference. And so the difference between 80% of people doing well and 50% is huge, because that means most people get benefit.
And we've been talking a lot about spinal cord stimulation, and thank you for showing us for the viewers, but we'll put an electrode in the epidural space, and when we turn it on, we're interrupting pain signals on the way to the brain through the spinal cord. But there's other types of neuromodulation as well.
Yep, that's right.
Would you mind telling us a couple of the other options for neuromodulation?
Yeah, and a lot of these, so back when we did our training, there was something called peripheral nerve stimulation. And that's, instead of putting these little leads with energy on the spinal canal area, that goes on the nerves themselves, nerves that are damaged.
Like peripheral nerves, like in your arm or your leg.
That's right, like you would, like your sciatic nerve, the biggest nerve in the body. So sometimes you'll use that for foot.
You can stimulate the sciatic.
You can.
That's amazing.
You can. The femoral nerve, same kind of thing in the front of the body.
Wow.
So one of the things, some of the early research on this stuff is that peripheral nerve stimulation worked really well for certain kinds of pain, and spinal cord stimulation worked really well. But what we've seen in the last few years is there's been a few companies that have come out with these really kind of minimally invasive peripheral nerve stimulation treatment options. And so for some patients, that may be simpler, easier, and more effective for their pain condition. So peripheral nerve stimulation can work better for certain conditions. And so there are all these peripheral nerves all over your body, and they all transmit pain. And so same thing, we do a trial where you place a little tiny lead along those nerves, and then you watch and see if the pain feels better.
And I wanted to show the viewers at home just some of this technology, because it still blows me away. You can hold that, thank you. So I just wanted to show this to the viewers at home. I kind of feel like Vanna White. The viewers at home. This is the IPG. This communicates with an electrode that you could put directly on a nerve. And if you look, this is smaller than the head of my pinky. And so this is what we would place in with a very tiny incision, and then you actually wear a battery externally, and so you can put this on the area of your pain and then take it off as you want. And what we're learning more about neuromodulation is it doesn't have to be on all the time, right?
That's right, yeah. There's some kind of carryover effect where you could stimulate for, let's say, 4 hours a day, and then you might get 16 hours of relief.
That's one of the biggest questions that my patients ask is if they have to charge the battery, and how long is it? How long does it last?
Would you tell our viewers a little bit about the difference between a rechargeable battery and a non-rechargeable battery?
So when this, what's interesting was when this therapy first came out, so it was actually 1967.
Is that right?
A neurosurgeon,
Wow.
And so way back when, and they had, these giant batteries powering these devices externally. And then as, things have progressed, first the battery that we had was actually used radio frequency energy, so it was external, similar to what you're showing there. Then they came out with batteries that were rechargeable, non-rechargeable, and so the battery would have a certain lifespan, and so you would implant the battery. Maybe it would work for 3 years, 5 years, and then you have to surgically go and take out the battery and put in a new battery. And that's convenient in some ways because people turn it on, and then they kind of forget about it. Then the new innovation, actually, when we were doing our training, it kind of first came out and it was the rechargeable battery. And so the benefit of that one is you didn't have to go back in surgically. So it might last for 10 years.
And they were smaller, right?
They were thinner, smaller,
Right.
so less invasive. Yeah, so
This
here's
is a
an
good
example
of one,
of like the modern day rechargeable battery. So,
Right.
And that might look big for patients who are looking, but compared to what we used to use, I mean, we used to use like they look like a brick, and so this is actually really, really small compared to what we had in the past.
So what I'm hearing is, for many different nerve-based pain conditions, we can use electricity now instead of local anesthetic or steroid or whatever injections you've had. We can actually use electricity at very, very small doses to interrupt pain signals. Would you say it the same way?
Not only pain though, but there is a new product out now where you can actually stimulate the bladder for urinary incontinence and urinary retention.
And you recently had a patient in our clinic that we did that. Would you
Tori
tell
and
us
I
about?
both did. Yeah, she had suffered for years with urgency, where she was having to get up multiple times during the night to urinate, and she was saying like 20 or 40 times at night.
Yeah, terrible. So she had no quality of life.
None.
Huh. Yeah, she's going to the bathroom all the time.
Yeah, so we worked her up, Tori and I, and we did a trial of the axonics.
Yep, that's
and I remember her coming into the clinic and saying, "Can I just leave it in? Do you have to take out the trial?"
Oh, during the trial?
During the trial, because it had worked so well for her. And she's probably, 2 or 3 months post now, and still, she says that she went from 20 or 40 times per night having to wake up and urinate to like 2 or 3.
Yeah.
So it completely changed her life.
Absolutely. Yeah, I just saw her a couple days ago. But yeah, I mean, it's an incredible technology that we have now, and it really wasn't available before. So the newest versions of it, the battery is so tiny, and basically that stays with her, and she recharges in this system. She recharges through her skin every couple of weeks, and so it obviously massive dramatic difference. And for her, there was a little bit of the pain issue, but a lot of it was the incontinence issue, and completely changed her life.
Yeah, and I think when we could talk about stories that we've had over the years, but one that always kind of means a lot to me is when I first came to town. I was working at Mayo Clinic. We were both working at Mayo and treating patients, and this patient came who had such severe pain in his arm that he was actually there for an amputation. And he had this terrible injury, and they sent him up to the pain clinic and said, "Is there anything else you guys can do?" As I talked to this gentleman, he had already tried spinal cord stimulation in the neck, and he still had pain. And he basically says, "Are there any other options? Because if not, I'm going to get an amputation. I can't continue to take this pain." We've learned over the last 15 or 20 years that the amputation doesn't even stop the pain.
Oftentimes that doesn't help.
Right, and so I talked to him, and we decided to do a peripheral stimulator. So the same way, it's not all spinal cord stimulation, but peripheral nerve stimulation, or even using stimulation for bladder control, as you talked about. So with this gentleman, we ended up doing peripheral stim under his clavicle to the plexus of nerves that went to his arm, and we took away like 80% of his pain, and it helped him save his arm. And so spinal cord stimulation for me has always had such a close place to my heart. Have you had stories like that over the years, Tori, that meant a lot to you?
Yeah, we have so many stories like that, where people who couldn't walk more than just a few feet, all of a sudden they can walk, several blocks, or they can walk their dog. Just like simple things that you didn't think would make a huge difference makes a dramatic difference in someone's life. One thing I want to mention based on that story, just because that was 15 years ago, 14 years ago, what's crazy is we talked about these new technologies, these new companies, and what's so interesting is there's some really big research studies looking at people who've tried this in the past and it didn't work.
That's right.
And using the newer technology, it works. And that's been, for me, that's really rewarding, because these people have done everything they can to get better, and they've tried everything, and they had surgery, and it goes on and on and on, and they're just like, they have just a teeny bit of hope, and then basically you do something and it makes a massive difference.
Well, I'm glad you said hope. I think that's one of the things that we do a lot in our clinic, is we do provide hope for patients. Our mentor, Dr. Rax at Texas Tech, I think one of the things he did so well was provide hope, to say, no matter what your pain is, no matter where it's coming from, we are going to figure this out and help you, solve it.
That's right.
Guys, thanks for joining us on today's episode of The Pain Show. If you want more information about neuromodulation, you can check out our video page. You can go to our website at arizonapain.com. Feel free to like us and share us and subscribe to our channel. And we hope that you'll join us on our journey as we learn more and teach you guys more about pain.